and still see the larynx, hyoid bone, thyrohyoid ligament, thyroid cartilage, cricoid cartilage, cricothyroid ligaments, and the trachea. But we are going to focus on the lungs. If the label is right here or right here, that is the yellow, okay? That is the apex of the lung. If the label is right down here or down here, or even if it is at the very edge right here or right here, that is not the base. In this model, that is the diaphragm. That is the diaphragm. And if this is a diaphragm that is separating the abdominal cavity from the chest cavity, what is this blood vessel? Remember?
Aorta.
Which aorta?
Descending.
That's sending what?
Abdominal.
That's sending abdominal aorta right there. And this one, what is this one? You haven't had it yet, but try to guess.
The esophagus.
That is the esophagus, coming right along and coming into the stomach right here, right at this point. Okay? So this is the diaphragm. There is another model where there is no diaphragm, and that is the one when you have the label down here, that is going to be the base of the lung, and I hopefully will be able to show it to you next time. Okay? So these are the two lungs. In the two lungs, we have, this is the right lung, and we have this very long fissure that goes all the way down like that. That is called the oblique fissure. And then we have this other fissure that goes across like this, and this one is called the horizontal fissure. The horizontal fissure, like that. Okay? The red is the oblique fissure, the green is the horizontal fissure, dividing the right lung into three lobes. Okay? Here is the inferior lobe, here is the middle lobe, and here is the superior lobe. Let us switch here. Okay? These are the three lobes. Now, if you look at the left lung, we don't have a horizontal fissure, but we have this very long oblique fissure right here, and that divides the lung into just a superior lobe and an inferior lobe. Okay? But right here on the right lung, on the left lung I mean, we have this structure that could be labeled just like this. Could be labeled just like that. Okay? And this structure is what?
Cardiac notch.
The cardiac notch. Notice that is where the heart lodges itself. Okay? Now, if you remove these two lungs and you found them just lying by themselves like that, you can still recognize which one is which. Easy way. The fat one is the right one, the skinny one is the left one. But you can also notice that we have the oblique fissure, we have the horizontal fissure, inferior lobe, middle lobe, superior lobe. You can also notice here in the left that we have only the oblique fissure, inferior, superior, and the cardiac notch in this case can also be labeled inside here, just like this. Just like that. That is the cardiac notch. Come on. Okay, can be labeled right here, and that is still the cardiac notch right there. Okay? Now, if you find the lung sitting by itself out here like this, and this area is labeled just like this, here, and I'll show it to you in a minute here. Okay? This area is supposed to be in both sides, but they're only showing it in this area. This is what we call the hilum. That is the area where the blood vessels and the bronchioles, the main bronchi, go into the lung tissue. And it will be labeled, this is the only place where it could be labeled, right there. That is the hilum. And the question is going, it is not shown in any of your lab models, okay, in your book, but it is shown right here because I removed the lung. This is the hilum. This is the only place where it will be labeled, okay? That is the hilum. Let me put the green in it again so that your picture will look pretty. Okay. Now that is the hilum. Now, we said that no matter whether it is the right lung or the left lung, no matter whether it is a superior, inferior, or middle lobe, all lobes are made of lobules. And here is a lobule.